Welcome back to Between Two Cheeks.
I'm Dr. Chong, and we're going to talk about all the things that itch, burn, bleed, and hurt back there.
And I'm Dr. Tommeraasen. Today's topic is small, but mighty painful. That's right. Today we're going to talk about anal fissures.
Not to be confused with hemorrhoids,
but just as unpleasant.
If pooping feels like you're passing knives or shards of glass back there, then you most likely have a fissure.
Let's break down what it is, why it hurts so bad, and what we can do to help you out.
Between two cheeks, anal fissures.
What are anal fissures?
An anal fissure is a small tear in the lining of the anus, and that can be caused by anything that can cause trauma, such as a hard stool passing through the anus.
So if you are suffering from an anal fissure, some of the symptoms you may experience include, but are not limited to, sharp pain during or after bowel movements, and that pain can last upwards of a few hours after your bowel movements. You may also notice some bright red blood on your toilet paper, or even notice that your bowel movements are streaked with bright red blood. Lastly, it's not uncommon for people to experience tightness or spasms in their sphincter muscles, which will often feel like fullness in your rectum.
Just think of it as a paper cut back there in the worst possible location.
People mix them up all the time, but they are separate issues.
So with hemorrhoids, you can still have pain, but a lot of times you would also experience some swelling back there or extra tissue that's protruded out that wasn't there previously.
Think of anal fissures as like a paper cut by your anus. It's a tear in your skin and it hurts really bad, and that only gets worse with bowel movements. Additionally, you can experience blood in your stools as a result of that paper cut. This may differ from the symptoms you would experience from an anal fissure, which is typically accompanied by severe sharp pain and then streaks of blood in your stool.
And sometimes you may be lucky enough to have both.
Many fissures will heal on their own with the right support.
Now's the time to treat your bum like royalty.
Here are some home care tips. Increase your fiber in your water intake, utilizing warm sitz baths after each bowel movements, avoiding straining, using soft TP or a bidet. Sometimes people do require topical numbing creams, which our office can help prescribe for you. If all of this fails, there are some medicines that we can prescribe in the office as well to help the fissure heal. A lot of the times when fissures fail to heal, it's as a result of the pressure generated from having a tense sphincter muscle. The surgeries that we at Paragon offer look to relieve that pressure and in order to help facilitate healing of your fissure. We can stop the madness.
Just call us.
Prevention is everything, because if you've had one,
you don't want another.
Long-term prevention tips include staying hydrated, eating enough fiber, not delaying your bathroom urges, avoiding aggressive wiping, and managing constipation and diarrhea early. If you're wincing every time you poop, it's not in your head.
Anal fissures are painful, but they will heal, and we can help you get there.
Take care of your gut.
And your cheeks will thank you.
Thanks for watching Between Two Cheeks. Like, subscribe, and send this to someone who avoids spicy foods for reasons they don't talk about.
Check out our next episode of Between Two Cheeks, where we normalize all the weird stuff that your gut is already doing. Until then, stay gentle and stay cheeky.